There may be a microscopic wound in your body that you have never thought about. If you have advanced gum inflammation, and a significant percentage of adults do, then part of that gum barrier can become ulcerated, almost like a tiny wound hidden under the gum line. That tissue is thin. It is highly vascularized, and when bacteria sit on it, they do not always stay on the surface. They can get in, not in some rare dramatic event. Not only during a dental procedure, but sometimes even during daily activities like brushing, particularly when gums bleed. If the tissue is compromised, the door may be open. Most of the time, this is not a problem. Your immune system deals with it. The bacteria are cleared within minutes. But when the inflammation is chronic and the exposure is repeated day after day, month after month, year after year, the cumulative effect may matter more than we once thought. Over the last 4 episodes, we have explored the signals, systems, and ecosystems inside your mouth. Today, we follow what happens when those systems break down. This is episode 9 of the Dental Longevity Show, and this is the episode where the mouth stops being separate from the body. The word bacteremia simply means the presence of bacteria in the bloodstream. It sounds alarming, but it is actually more common than you might think. Every time you brush your teeth with inflamed, bleeding gums, there is a measurable probability that some bacteria from the oral biofilm enter the bloodstream through the compromised gum tissue. Research has shown this happens in a significant percentage of cases, especially after dental procedures, but also after everyday activities like toothbrushing, particularly when gingival bleeding is present. The key word is transient. In a healthy person, the immune system recognizes these bacteria within minutes and eliminates them. Your liver, your spleen, your white blood cells, they are built for this. Transient bacteremia is not by itself a disease. It is a biological event that the body is equipped to manage. But here is where it gets more interesting. In a person with chronic periodontitis, the frequency and duration of these episodes may be different. The bacterial load is higher, the tissue is more compromised, the exposure is more sustained, and the types of bacteria involved may include species that have evolved particularly effective strategies for surviving in the bloodstream. A comprehensive review, published in Frontiers in Immunology in 2026, described 3 main pathways through which the oral cavity may influence systemic health: direct spread of bacteria through the blood, circulation of bacterial toxins, and the systemic amplification of inflammatory signals originally triggered in the mouth. 3 pathways. 1 important possible source: inflamed gum tissue. This is the part that changed the way many researchers think about oral health. In 2017, a study using advanced genetic sequencing analyzed tissue samples from the coronary and femoral arteries of patients with atherosclerotic cardiovascular disease. The researchers were not looking at plaque in the mouth. They were looking at plaque inside arteries. And what they found was that the most abundant bacterial species detected in those arterial tissues was Porphyromonas gingivalis, one of the primary pathogens associated with periodontal disease. Now, I want to be careful here. Finding a bacterium in a tissue does not prove it caused the disease. Presence is not causation. It is possible that these bacteria are bystanders, carried there by the bloodstream but not actively contributing to the pathology. That is a real possibility and an active area of research. But their presence raises a question that is hard to ignore. How did oral bacteria end up inside the walls of coronary arteries? And what does it mean that they are consistently found there across multiple studies? What we can say is this: the mouth is not sealed off from the rest of the body. There is a highway, a vascular network that connects the gum tissue to the general circulation. And when the gums are chronically inflamed, that highway may carry more than blood. It may carry passengers. But here is something important to understand. Bacteria themselves are not the only thing that can travel from the mouth. When we talk about the mouth-body connection, most people picture bacteria physically moving through the bloodstream and landing somewhere. That is one pathway, and it is real, but it is not the only one. A second pathway involves bacterial toxins. Certain oral bacteria produce molecules, particularly lipopolysaccharides, that can enter the bloodstream even without the bacteria themselves being alive and viable. These molecules can trigger inflammatory responses in distant tissues. And a third pathway may be the most significant of all, the systemic spread of inflammation itself. When gum tissue is chronically inflamed, it does not just produce a local response. It releases inflammatory mediators, signaling molecules, into the bloodstream. And those molecules can contribute to a generalized state of low-grade inflammation throughout the body. An overview published in Frontiers in Physiology described how these three mechanisms, bacteremia, toxin circulation, and inflammatory signaling, may operate simultaneously and reinforce each other, creating a sustained biological connection between the mouth and the rest of the body. It is not about one bacterium and one disease, it is about a chronic source of biological stress that may, over time, contribute to the body's overall inflammatory burden. We talked about that burden in episode 8. Now you know one of the places where it may originate. Now, before we go any further, let me say something that I think is essential. This episode is not telling you that gum disease causes heart disease. It is not telling you that brushing your teeth will prevent a heart attack. And it is not telling you that periodontitis is the hidden cause of every systemic illness. What the research suggests is an association, a statistically significant relationship, between chronic periodontal disease and an increased risk for certain systemic conditions. The mechanisms we just described are biologically plausible, but in most cases, causation has not been definitively established. A recent narrative review in the Journal of Pharmacy and Bioallied Sciences emphasized this point. The relationship between periodontitis and conditions like cardiovascular disease, diabetes, and rheumatoid arthritis involves shared pathways and shared risk factors, not a simple cause and effect chain. I say this because the worst thing this series could do is replace one kind of oversimplification with another. The old story was, the mouth is separate. The new story should not be, the mouth causes everything. The truth is more nuanced, and nuance is not weakness, it is precision. So if we cannot say that periodontal disease causes systemic disease, why does this matter? Because it shifts the frame. For decades, oral health was treated as a cosmetic or functional concern. You went to the dentist to fix a cavity, whiten your teeth, or deal with pain. The idea that treating your gums might have implications for your cardiovascular system, your metabolic health, or your inflammatory status, that was not part of the conversation. Now it is. And even without definitive proof of causation, the biological plausibility is strong enough that many researchers and clinicians argue for a more integrated approach, one that treats the mouth as part of the body, not a separate department. That does not mean your dentist should be prescribing heart medication. It means your dentist and your physician should be talking to each other. It means chronic gum inflammation should not be dismissed as a minor inconvenience. And it means that taking care of your oral health is not vanity. It may be one of the most accessible ways to reduce your body's overall inflammatory load. Let me leave you with this image. Your mouth is connected to the rest of your body through one of the most vascularized tissues you have. When that tissue is healthy, the barrier holds. When it is chronically inflamed, the barrier weakens. And through that barrier, bacteria, toxins, and inflammatory signals may enter the general circulation. This is no longer just an abstract idea. Oral bacteria have been detected in arterial tissue. Inflammatory markers can be measured in the blood. The pathways are being mapped. The mouth-body highway is real, and what travels on it depends in part on the condition of your gums. In the next episode, we are going to ask a different kind of question. If all of this is true, if the mouth really is connected to the body, then what does real prevention actually look like? Episode 10, Prevention is not a cleaning. I am Dr. Mario Parra. Thanks for watching. Pay attention. Your body already is.